Meet the former resident council president of a residential mental health facility who we'll refer to as John. John's facility provides mental health services and a safe place to live for individuals ready to discharge from institutions for mental disease, or IMD, acute psychiatric inpatient units, or crisis residential facilities. As the former resident council president, John has a good pulse on the services, protocols, and happenings within his residential program. Since the start of the pandemic, the program largely shifted to using telehealth for behavioral health appointments. John feels supported by staff who are available to help troubleshoot when technical issues arise. We've all experienced the frustration of a slow computer or spotty Wi-Fi. When using telehealth, troubleshooting these issues can be the difference between receiving care and having to miss the appointment. John says,
I've never had to do it independently. I've always had some sort of support. It's either a case aide, a therapist, or a manager. Somebody was there to help me.
John feels relieved that he can comfortably meet with his providers virtually. He says,
It kept other people from getting sick. It's kind of like a buffer for us. I don't want to get the coronavirus again. It was awful. I think it's very helpful considering the circumstances.
John has also noticed that telehealth is time effective, allowing multiple patients to be seen in a shorter period of time. Sometimes, telehealth appointments interfere with clients' scheduled free time, but the benefits, time efficiency, and COVID safety outweigh the drawbacks for John. Though there are times when John would prefer to see a provider in person, to get his blood pressure checked, for example. Generally, the quality of care he receives using telehealth is quite good. He appreciates the personal touch his psychiatrist uses, even when they meet virtually. Telehealth allows John to communicate effectively with both his behavioral health and physical health providers, but he finds there's often a lack of communication between his providers. John feels his providers too often rely on his own ability to bridge the connection between his various physical and behavioral health providers, a daunting task for anyone without a background in healthcare. John wonders what it would be like to have a telehealth call with both his behavioral health and physical health provider present, instead of having to be the bridge between these two entities. John would like them to meet together and discuss his health while he can listen and be part of the conversation. As John points out, telehealth offers a unique opportunity to provide care in a new way, one that supports behavioral health and primary care integration, all while increasing patient engagement and involvement in their own care. Let's think of creative ways we might use telehealth, not just to increase time efficiency and access to care, but to transform the way care is delivered. Telehealth doesn't look the same for each person, and it shouldn't if we're listening to those we're trying to serve. Incorporate truly patient-centered practices and policies with enough flexibility for providers to meet those seeking service in exactly the place, time, and manner they need. This will improve outcomes, satisfaction, and adherence.